Hello everybody, my name is Jason Hafner and I'm the Chief Development Officer here at Fast Pace Health. With me is Nikita Duke, the Director of Behavioral Health Services for Fast Pace. Welcome.
Good morning, thank you.
So let's talk about behavioral health. You obviously have a background in that. You are a licensed professional. Talk about that a little bit.
So after being a psych nurse a little over 3 years, I got my psychiatric nurse practitioner degree from University of South Alabama, and actually was going to do the practice route first, and academia pulled me. So I actually went to go teach psychiatric nursing in the bachelor's program at UNA for about 5 years total. In between there, I did go to practice. I thought, okay, now I need to go and get some experience and practice, and wanted that feeling of really helping others. And end up going back to teaching though, still have a heart for teaching. And then it kind of led me from there into adventuring into here. And coming into Fast Pace and having the opportunity to, hey, you could, teach others, you could grow this program and help people in these rural areas. And so I have been in this role now, this August will be 3 years full time. And so,
Great.
Yeah, behavioral health is definitely close to my heart.
So we're in different times. 2020 just ended, we're into 2021, and obviously the world is a little bit different. What has the current environment that we're in, how has that affected people's behavioral health or mental health, if you will?
Yeah, that is 2020 for sure, and that is one thing, across even in a lot of doctor's offices when people are avoiding them, behavioral health didn't much slow down. I also am on psych nurse practitioner groups on Facebook, and just watching people respond, it's really kind of sad. There for a while, it seemed almost every day or every other day, a practitioner losing somebody due to suicide, due to social isolation, not being able to see your family. I think we have human needs. We need that touch and that comfort, and especially different cultures and things like that. I come from a large Italian family that, we're used to, it's hug and family, and it's really difficult when you can't see your family. You're afraid to get someone sick. Not actually getting that physical contact has really put a damper, especially with children. I do want to say with schools too. I think with a lot of kids going virtual, you hear a lot more children more sad, more depressed. I was actually reading a mother's story on Facebook the other day about how her son is actually really struggling.
But you and your team are here to help.
Yeah,
so talk about that. How do you help someone that has, you just named a number of different issues that could arise?
If someone needs medication management, if they, just really depressed, really anxious, maybe they've gone through some trauma, and maybe it's just 2020 and they've just had a lot of stress and they need something, to kind of take the edge off, we're able to provide those medications. We also treat more severe mental illness, so we can provide those services to them, and actually we can do virtually. Through telepsych, and since COVID we've done a lot of home visits. Patients are really enjoying those, and not, if they're nervous of COVID, they can do that. And besides medication management, we can also do counseling and therapy. There's people who just maybe want to talk to somebody. Maybe it's a strain on your marriage with you both working from home and trying to share office space or homeschool the kids, and that's been more difficult on people. And so if they just need a counselor, someone to talk to, work on good coping strategies, how to take care of their anxiety, that's definitely an option as well.
So if I'm somebody that needs these services, I would imagine there'd be a little bit of hesitancy from time to time of people saying, well, maybe, if I go and get help, that's a sign of weakness. Or if people see me in an office or they see me getting behavioral health, then maybe that's a stigma that I don't want. Talk about that a little bit.
I think that when people want to put down for work that they have an illness, it's like, oh, I have hypertension, I have blood pressure issues, I have diabetes, but to say you have depression, anxiety is still, and I think some of that is, some of them says that's how you're raised, and that pride and no, this is all in your head, it's not real, cultural beliefs, and then I also think, there is still that stigma of, am I the one getting help? Even when it comes to attention deficit disorder, people avoiding getting help because, well, if I go get a medicine, then the medicine's doing it for me. I'm cheating. I'm not really, doing as good as I could in school. Well, no, actually, maybe you would actually do better. You would be less stressed, less anxious, being able to focus, stay organized. But there is that stigma that it is still not as seen as important as a medical, as your physical health, then it is. It's just as important. If I'm really anxious, then I may not be as social and I'm more isolated again, and then I'm in my thoughts, and sometimes people's mind starts running and they don't have that outlet to vent. And sometimes, you do hear of those stories, unfortunately, when people are not getting the help, they're not talking, they're keeping it bottled, either one day it kind of explodes per se. And unfortunately, those are the cases that you hear of suicide. No one ever knew, no one saw it coming. They never reached out and asked for help.
Yeah. But I should feel good that this is a confidential service.
So the services that FastPace help with us with the behavioral health program are 100% confidential. Having multiple clinic locations, that's an urgent care, in these rural communities where everybody does know everybody, usually smaller knit communities, no one knows why you're there. We are scheduled appointments, but you're able to come in the clinic if you don't have great internet at home, or maybe that not as tech savvy and a little bit difficult to work computers or a tablet, or maybe you just don't have those type devices. You're still able to go to the clinic and have a service virtually with us.
So you mentioned you're able to have both a telehealth behavioral health service and also on-site service. I would imagine people feel very comfortable utilizing the telehealth services right now.
Reality is, it's either that or my closest possible mental health center is 45 minutes, an hour away, if I have the gas money today to get there. And I realize the more and more, really doing this program and thinking about it, it's a service versus none. Mm-hmm. And I think when people do it, they realize, oh, this is the same thing if they were in person. Sometimes just giving it a chance. And we've actually had success. Our youngest kiddo has been 5, and our oldest patient was, I think, like 89 when I started seeing her a couple years ago. She's 90 or 91 and now.
Great.
And so, we've had a wide acceptance with the telehealth platform.
So if Nikita is my provider, do I get to see her every single time? And if that is the case, how long are the sessions?
Great question. So yes, we like to try to keep our relationships. So if you see one of us, your therapists, that's going to be the same therapist you see it. There's no need to restart your story. If you're going to see a psych nurse practitioner, you want to build that relationship so that we know what's going on, that you don't have to repeat or see a different person each time and your medication gets changed. So for therapy appointments, the estimated length is usually about an hour. Usually, there are some patients who may not be able to tolerate the full hour, depending on what they're going through. And then for nurse practitioners, it just kind of varies. The first sessions are usually an hour. We do a full psychiatric evaluation, gather your social history, your developmental if you're a child, to make sure if there's something happened in utero that we can gather a little bit more data to try to find a diagnosis. So those are about an hour, and then the follow-ups are usually 20 minutes, and sometimes more if someone comes in and they have a lot to talk about and they are in crisis and they're really having a hard time. We're not going to just rush them out the door. I don't think any of the team is that way at all. I think that they want to listen, they want to help, but we're going to try to provide that if we can with them.
How is this paid for? How easy is it to get this covered?
We accept from self-pay. We can do that option as well if someone does not have that insurance option or an insurance that doesn't pay for the telehealth service version. We also do Medicaid plans, Medicare, and several private and commercial insurance plans as well.
Talk about some coping skills or some pearls that you have for people that might watch this and say, hey, I'd like to know a little bit of how I can help with my anxiety. I'll tap into your brain really quickly for some free advice. Do you have any advice for us?
I do. Definitely using your social support if talking with your family, your friends, if it's coworkers, definitely trying to find that person maybe that you can confide in and open and don't keep it bottled up. I think also things is keeping distraction when you are kind of thinking and your anxiety is racing through your mind. Find something that you enjoy. Run down the Quick Mart, get you a drink even. If you have a favorite drink at a local fast food restaurant, just kind of getting out for a minute sometimes helps. There are a lot of studies showing the correlation of being active and the relation to being able to sleep better, and then your brain heals and feeling better. So I think when it comes also to sleep as well, I should mention that when it comes to anxiety, people sometimes like, I can't sleep. Finding those restful things that, trying to put down the phone at a certain time or turn the light on your phone. Some phones have devices where you can turn on that blue light or whatever on at night. Doing that, some nice chamomile tea or the sleepy time tea, just something relaxing, whether it's lavender, people that like to do essential oils. Those are just little things that can help you.
Sure. We've got a month coming up here in May where we're here at FastPace. We're going to put a lot of emphasis on this type of healthcare, on behavioral health. Do you want to talk about that a little bit?
Yeah, so May is Mental Health Awareness Month, and so we also have a month kind of similar in October. But that is, it's one of those things that I think as us as a company and a program, as we continue to grow, I would like us continue to spread awareness. And maybe that is through more events and social media and things to really bring about that awareness. As our team grows, also to help and put an input, how can we make a difference in the community? How can we make people aware that, you don't have to wait until you're in crisis to get treatment. You don't have to wait. If you're perceiving that what you're going through is really big for you, it's really tearing you up inside, something's bothering you, that's very real for you. Someone else may think, well, that's not a big deal, or why are you upset over that? That's their perception. But for you, if you're really being bothered by something, if you're way down, even if your family's like, oh, you'll get over it. I mean, really look inside, and sometimes it's individual care. It's doing what's best for you. So again, someone's perception, that's their reality.
Yeah. So if I think there may be a problem, or even if I have a question on whether or not I should be feeling this way, it's okay to reach out for an appointment.
It is.
Great. What differentiates fast-paced behavioral health services from all the other behavioral health services that are out there? Because it's a growing industry right now, growing in healthcare services. So what are your thoughts on that?
I think the way that we differ for many of our patients, for one thing I can say, and a lot of telehealth companies are either, self-pay, or a monthly premium, you pay as you go, or, there's not. So I think one thing is we take insurance. I think that's one. And when I dive deeper in that, for a lot of patients who have said, I've never had another chance, because we also take some Medicaid products as well, that I've never had a chance to go anywhere else. I've only had the mental health center, so my availability for sometimes appointments have been 3 and 6 months just to get in. What we really strive for here at FastPace is trying to give people a sooner availability. My goal is always to try to stay within that 4-week for a new patient appointment. If we can get you in sooner, we sure try. If there's cancellations, reschedules, a lot of times with the counselor the same week or the next week, you can get to meet your counselor and start coping strategies. So I think that's one thing, 2 things. One being that we take the variety of insurances that you don't hear. Number 2 is that just the services being available more broadly. And then I really am going to stretch into number 3, saying, I still think we offer that anonymity that a lot of places don't have, that on-site option. And I'll tell you, as a behavioral health provider, it's been great that we have that accessibility if we need lab work, if they're on a certain drug that needs labs, or having that service there is a huge plus, I think. And we're a team. Having family nurse practitioners know that we're referring inside the same practice, and so knowing who your providers are, we get to know each other, whether it's, we're messaging through the online system or by phone calls and sharing patients, and knowing that, hey, I know where my patient's going and they're going to be seen, versus I'm sending them out and I just hope they go.
Right.
They can follow up. They're easier, like, are they being compliant? What medications are you taking? Being a team of FastPace, I think, as just better quality of care.
Yeah. So we have a lot of touch points because we've got our on-site 120, 130 clinics or so within the FastPace network. So we're able to communicate with all the different services, service lines, urgent care, primary care. You want to talk about that a little bit?
Pretty much everywhere that there is a fast-paced clinic, behavioral health is an option at that clinic. We just recently expanded into Louisiana and getting that going. And actually, behavioral health took a little small adventure outside of FastPace, and even jointly did a contract with a local university in Alabama, and we provide services there in their health services for college students. And I think we would love to eventually grow those directions and grow to maybe being school options and things like that.
What is your favorite thing about working for FastPace?
I think one of my favorite things is I really think we have an amazing team. Everybody's been super sweet from the beginning, from very supportive from our CEO, Greg, to Mr. McKenzie, who's our Chief Legal Officer and my executive sponsor. They've been wonderful, very supportive. They want success for the program. They believe in the program. And I honestly, my team, we call ourselves a family. We have rough days and bad days, and we can laugh. I was actually on the way up here today traveling. The song Lean On Me came on, and I have to say, I was like, that's our team. I really do feel like we lean on each other, and we all want what's best for the patient at the end of the day.
Great. Well, Nikita, thank you for your time. This was very enlightening. We look forward to hearing more about all the great things that you're doing for the rural communities within Fast Pace and for behavioral health as a whole. So thank you.
No, thank you.